If you've been watching some of our surgical videos, you may notice that there is a difference in the way that the patient is placed under anesthesia. And there's a number of reasons for this. Number one, the way that the patient wakes up. Number two, what happens during the procedure. And number three, the overall feeling that the patient has during the recovery phase is super important to us. When patients are waking up from a general anesthetic, which is enough medication given to a patient that would cause them to not be able to breathe on their own or dulls the senses based on their oxygen and carbon dioxide exchange, and then requires a tube to be placed into the throat. That tube has to be taken out. When that tube is taken out, it is extremely irritating to the vocal cords and to the throat. Patients gag, patients sometimes cough, and that causes, guess what? Bruising, more bruising to occur. Obviously, you want to have as little bruising as possible. You want to have as little bleeding as possible after surgery. And that's one way for us to be able to limit that. With sedation anesthetic, we put a little gag in the mouth to keep the tongue out of the way, or a trumpet or a nasal trumpet into the nose. And on some occasions, something called a laryngeal mask, which engages on top of the vocal cords, just keeps everything out of the way. Patient is breathing on their own. No machine is required for them to breathe. And when it comes out, they're super comfortable. They're breathing on their own still with way less bruising, way less bleeding, and a lot more comfort while they're waking up.